Hello class and welcome to week 9, PA113. We are in chapter 11 this week talking about cardiovascular drugs. And before I lecture, I wanted to do some housekeeping. A lot of you are not turning in the pronunciation test, and I think that's because you don't know how to pronounce the words. So I want to pronounce them now, and then you can send them to me. Just record them on your phone and then email them to me. Here is week 9 pronunciation words: clonidine, Cozar, digoxin, Inderol, Indicane, nifedipine, nitroglycerin, propranolol, Rithmol, simvastatin. And they have ways that you can sound it out, but now that you've heard me talk and you know them, go ahead and repeat after me, record them, and send them to me in an email. And that is as easy as that to get those points. All right, cardiovascular drugs. Cardio, we're talking about the heart, talking about hypertension, drugs to treat that. The drugs that we just talked about, those are drugs that will help you help someone with hypertension or with heart problems. All right, so chapter 11, again, cardiovascular, treating hypertension, and it says, we are on page 169 in your book, and it says, cardiovascular drugs are used to treat diseases of the heart and blood vessels. These diseases include hypertension, which is abbreviated HTN, hyperlipidemia. If you break that down, hyper means high, lipid means fat, demia means swelling. So it is the swelling of the fat cells, congestive heart failure, or CHF. And you can go on and see what those different diseases are. So let's just talk about hypertension, because that is something that you will see all the time in the pharmacy. And you might also see doctors abbreviate on the prescription 1QD PRN HTN. So one tablet or one capsule daily as needed for hypertension. So hypertension is characterized as an increase in the systolic and or diastolic blood pressure. Hypertension is caused by arteriosclerosis, a big word, say that 3 times fast, kidney disease, and other diseases, or it may have no identified cause, in which case it is known as essential hypertension. Normal blood pressure is defined as being lower than 120/80. Prehypertension is defined as the systolic blood pressure between 120 and 130. So systolic is on top, that number that is on top. And then the diastolic is the one on the bottom, which is 80 to 89 is what prehypertension is. Blood pressure readings higher than this are defined as hypertension. Over time, untreated hypertension can damage the heart, blood vessels, kidneys, and other organs. And so let's talk about the drugs that they will put people on. The diuretic drugs for hypertension. So this is what we commonly refer to as a water pill. It's something that they'll try if you are pre-hypertension. You just have a little bit of irregularity, and it really is a lot of water. They call it a water pill because it helps to eliminate water from your system. So sometimes maybe your kidneys aren't processing water properly, or your body is hanging on to a lot of fluid, which can give you hypertension. And so they'll try this, what is called a water pill, and that makes you urinate a whole lot. So I would tell my patients, do not take the water pill at night. You'll be up all night. Water pills are to be taken in the morning, so then that during the day that you can urinate all day, get rid of that extra water, and then at night you won't be subject to getting up every 15-20 minutes. So that is the digoxin that you see in your words for this week. That is that medication. Then if that does not work and you're still having hypertension, they'll move on to what is called a beta blocker. And so you've got Cartrol, Corgard, Levitol, Vaskin, Inderol or propranolol, which you guys have as one of your words this week. And what a beta blocker does is the action of it is the epinephrine or the beta receptors decrease the heart rate and dilate the blood vessels. So it will bring your heart rate down and it will dilate the blood vessels. So both of these effects lower the blood pressure. So dilate meaning to increase the size of them. The category includes beta blocker drugs and cardioselective beta blocker drugs. There's also called alpha beta blocker drugs for hypertension, so you can read a little bit about that. I'm just going to skim through this chapter a little more. ACE inhibitor drugs for hypertension. So there's a lot of different things that people can choose, or the doctor can choose, or almost just use to see if it'll work for a little while. If it doesn't, they can change it. And it's very helpful for patients to say, well, I don't know if this will work for me. If it's not working, we'll change it. We'll get it approved by something else. The ACE inhibitor drugs for hypertension, these are always easy to spot. ACE or ACE. These are prill drugs. And so you have, I think, a prill. No, you don't have a prill drug. Okay. So these are like benzapril, captopril, enlapril. You can read them on down. Ramipril. These are all ACE inhibitor medications, and how they work is the drugs block an enzyme in the blood that converts angiotensin 1 to angiotensin 2. And so the angiotensin 2 is a vasoconstrictor. When the enzyme is blocked, angiotensin 2 is not produced. The blood vessels dilate and this decreases the blood pressure. So isn't that science is amazing, and drugs are amazing that can help us bring down hypertension. Can you imagine hundreds of years ago when we didn't have these medications and people weren't being treated for hypertension, how easily they would just pass away? The average lifespan used to be, in our 40s or 50s and maybe our 50s. And now we are way living past the 70s. And it is, said that later in 2020, I think, 2025, they released a report that we'll be living into our hundreds. Just with the medications that we have now, it's amazing, and I'm so glad that we're in this field because it's just getting better and better. We are finding drugs that will help us live longer and stay healthier longer and all of that. Okay, the angiotensin 2 receptors, this is where we come in with the COZAR, and we have that as one of our words this week, so you've seen that a couple times. And they also block drugs to keep the angiotensin 2 from binding and activating the receptors on the smooth muscle of the blood vessels, making sure that they have that. There's also, if you go on to hyperlipidemia, like we talked about, lowering the fat cells in your body, and that is like Lipitor, and these are all statin drugs, so they all end in statin, so you can tell these very easily as well. Hyperlipidemia, ACE drugs, remember, they end in prill. Then the statin drugs statin drugs are your hyperlipidemia medications or your cholesterol medications. So Lipitor, you've probably heard of. Zocor, which is your simvastatin, which is one of our words this week. So the other one I wanted to get to really quickly before I stopped was the nitroglycerin. Nitroglycerin was one of the discussions we talked about earlier, I think, in this chapter or in this class. But nitroglycerin is for people who have high blood pressure, and if they need it, they can take it to help with a heart attack, or if they're feeling like they may have a heart attack, they'll take that nitroglycerin, which they'll have on their bodies at all times, maybe even wear something around their neck so that someone might give it to them. It's one under the tongue every 5 minutes until the chest pain goes away. And so nitroglycerin is an emergency medication. It is also can be used just to regulate heart rate, And there are some interactions. The biggest one that you can think of is Viagra. So anyone on nitroglycerin and taking Viagra is a very deadly combination, so they shouldn't do that. So that's just some things that I wanted you to know about. That's one of your words this week. So remember, at the end of chapter 11, you have some things to get done. You have, ooh, that's a pretty long chapter, but you do have your quiz yourself and clinical applications, so make sure that you do all those and get those turned in by Sunday evening. I hope you have a great week. I hope this helped a lot. If not, please email me and let me know. Have a great week.